My name is Dr. Jatin Dhamecha and welcome to our today's demo lecture. We will be talking about endocrinology today. The topic today is on primary and secondary adrenal insufficiency. First, we will go through what you need to do to get your answer right on your step one. Then we will go through the fundamentals, the theory portion. Before we go through the theory, I will show you three questions that are very representative of the exam. So these are the kind of questions that you will see in your step two. So our main focus will be on these things: signs, symptoms, diagnostics, and treatment. And lastly, prognostics of that condition that is being asked in the question itself. Prognostics is something that I feel you should focus on because that is the trajectory where step two is going. So you guys have to know the base knowledge of the topic of the question. And that will include sign, symptom, diagnostic, treatment, prognostic. And you need to know the same things about the options as well. So let's say you have a question and you are confused between two options. If you know everything about both options, then you will be able to exclude one of them easily. Otherwise, it becomes very difficult. Second, in order to solve a question, this is just not enough. You may also need to do something extra. So the question may present a partograph, and if you cannot understand what's going on in partograph, you can still answer the question. I have heard this opinion a lot that you do not need to learn images. You can skip all the images and still get the answers right. I would call that a half-assed attempt. If you are going for an exam, I believe that you should know every single thing. In that case, you will be able to apply all the knowledge you have. So instead, what I recommend is that you learn about ECGs, you learn about X-rays and CT scans. ECG is a little bit difficult topic, but CTs and X-rays are very easy. Partograms are very easy. For ECG, we will have a dedicated session. It is a big topic, and I have learned that through a lot of resources. We can talk about it exhaustively. That is one characteristic information. Other type of characteristic information could be something like this: that cystic fibrosis that causes upper lobe bronchiectasis. This is a specific finding of cystic fibrosis. This may be a sentence within your question. But if you do not know that there is a specific upper lobe bronchiectasis, you may not be able to guess that the answer is cystic fibrosis. And this is the worst kind of thing to have because it requires you to have that specific set of information. If you do not have the information, you will not be getting the question right. So you cannot do a lot about this kind of thing. We can fight at all of these other fronts, but fighting at specific information is difficult because there is a limited amount of information you can remember. So this will not be a major focus. We will know only the high yield characteristic information of all the diseases, not every single bit of information about all the diseases. Next, first you need to know differentiation between two close options. When you know how to differentiate two very close conditions, it gives you a lot of advantage. So you will only have signs and symptoms and laboratory values at your disposal to differentiate two conditions. And differentiating two conditions is a very big, difficult, tenuous task. Examples of these close options could be: one of that is myopathies. Another example of that could be hyponatremia. So conditions like SIADH, cerebral salt wasting syndrome, and let's just say polydipsia, primary polydipsia. These conditions can become very close. All of them present with hyponatremia, but the volume status is different, urinary osmolality is different, serum osmolality is different. That is how you have to differentiate. So you have to know that as well. So in these two cases, we'll be making the differentiation based on either signs and symptoms or based on laboratory values. Lastly, there is one more thing that you need to remember, and this is what I call Cram worthy information. For example, developmental milestones is one of things that you cannot understand. You have to remember it. But what is more efficient is that if you cram these things up, then in the exam you will have much more time to go through that, retrieve that knowledge, and go through the question faster. So that is why I prefer that there is some information that should be crammed up. One of them is developmental milestone. Second is screening guidelines. And these screening guidelines that I mentioned earlier, you have to know about the diagnostics, treatment, prognostics. So screening guidelines will come under that. You know that a patient has otitis media. Now the question is whether you treat this patient with antibiotics or do you treat this patient supportively. That is the question. That is the whole crux of step 2. They want you to know the guidelines. Guidelines about screening, guidelines about treatment, guidelines about vaccination. In addition to that, there is also screenings for specific age groups. So in this specific age groups will be children, then it could be some syndromes like Turner syndromes in which you have to do additional screenings. Then there could be associations of syndrome with other conditions. So what we talked about here, like cystic fibrosis causing upper lobe bronchiectasis, that's a characteristic information that you have to remember. It is a cram-worthy information. You need to think the way examiner is thinking. How do you do that? That is the biggest question. How do you think like an examiner? For example, you have a whole paragraph of a question. There are three different sentences that point to three different diagnostics. What you should focus on is the one in which is referenced throughout the whole question. So if a risk factor for a certain condition is present, if investigation for a certain condition is present, if an investigation that is required for the other option is not present, in that case you have to go with the option that is most suggestive of the question. So that is how you proceed in questions where you have no idea what to do, when you cannot do anything at all. You are stuck at two options. You have done all of these things. You have remembered every single disease, sign, symptom, treatment, prognostics. You know the ECG, X-rays. You know the information as well. You can differentiate between those conditions. You remember screening guidelines as well. But it is not helping you. You are stuck at two different options. What do you do in this scenario? So this is our first question. Let's go through this question first. What is the best next step in management? First, start with the question. 42-year-old woman with 3-week history of fatigue, nausea, lethargy, diagnosed with sarcoidosis, treated with prednisone. Temperature is 98.6, pulse is 76, BP is 95/62, respirations are 16. Physical examination shows abdomen is soft, non-tender, bowel sounds are present. CNS shows weakness in proximal muscles bilaterally. What is the best next step in management? So these are your options. Please let me know in the chat. I want you guys to try and see if you can get all of the answers right. So this is our sample question. This is not much confusing. I did not make it too difficult or too confusing, but the difficulty of questions will increase as we go from 1 to 2, 2 to 3. The order of the question will also increase. So these will increase in difficulty. Now you have 5 options in front of you and you want to think the way the examiner is thinking. What have they mentioned here regarding the condition? First, they've given us symptoms fatigue, nausea, and lethargy. It is a 3-week history in a 42-year-old woman, right? Now, the patient was diagnosed with sarcoidosis and the patient is treated with prednisolone. We see during examination that BP is low, abdomen is soft, non-tender, bowel sounds are present. CNS examination shows weakness in proximal muscles bilaterally. So this is example of myopathy that we talked about here, proximal muscle weakness. There could be many causes behind this. One of them could be statin-induced myopathy as well. That would be the likely answer in this case because statin induced myopathy only presents with weakness, not any pain, and preferentially it affects lower limbs. So, likely it is prednisolone induced proximal muscle weakness. So, now we know that the patient is on prednisolone and has effects of prednisone as well. So, what would be the likely cause behind this condition? That's what the question is asking. Second, what would be your diagnostic modality for this patient? What is your next best step? So these are our options: late night salivary cortisol, 24-hour urinary cortisol, serum ACTH and cortisol, inferior petrosal sinus sampling, and CRH stimulation. Okay, so Jenny says it's E, CRH stimulation test. Question again when we Niyati. Yes, C is the right answer in this question. Why it is the answer, we will get to it when we go through the theory. But the answer to this question is C, serum ACTH and cortisol measurement. This is the preferred initial test for secondary or primary adrenal insufficiency. So when you have adrenal insufficiency, the way you proceed in USMLE exams is select the most non-invasive and non-harmful test first. Now let's move on with the question. So this is the same question. I added a little bit more information. So 42-year-old woman with 3-week history of fatigue, nausea, lethargy, diagnosed with sarcoidosis 9 years ago, being treated with prednisolone since 9 years. Now everything else is same. One additional information here is that menstruation is happening at regular 28 days and lasts 5 days. CNS examination similar, bilateral proximal muscle weakness. You did early morning ACTH and cortisol levels, and both were found to be low. But 1 hour after co-centropin stimulation, her cortisol increases to normal levels. So, what is the most likely diagnosis? First, they will give you a description of symptoms, then vital signs, then physical examination, then it could be any other information. Information could be sandwiched between these things. After physical examination, they will give you if any tests that they perform. So they perform ACTH and cortisol levels. The result of that tests are given now. They were found to be low, and 1 hour after co-centropin stimulation, her cortisol increases to normal levels. Let's just so what is the likely diagnosis? This is our question, and you can see this will uh, as you can see this will start getting harder. So A is not the right answer. A is autoimmune destruction of the bilateral adrenal glands. B is also not the right answer. A can be excluded very easily, and how? That is what we want to discuss during these fundamentals. So right now you can take guesses, they may not be right, but I hope after going through this you will be able to answer these questions with certainty. That's what my goal is. So we got two options: autoimmune destructions and secondary infiltration. There is also disruption of HP axis, ischemia of pituitary gland, and tuberculosis of adrenal glands. How do you get to the answer of this question? In order to get to the answer, first you need to know the classification and how is adrenal insufficiency classified. Is it primary? Is it secondary? If it is primary, then what is the cause? If it is secondary, then what is the cause? That is how you proceed. Now, what are the risk factors? What are the etiologies for secondary adrenal insufficiency, and what are the risk factors for primary? That is what you need to know in order to answer this question. And as you can see, this question is a little difficult than the questions you are used to on step 1. Step 1 is somewhat easier compared to step 2, because in step 2 you have to know things in very much minute detail, but once you know them it becomes easier. When once you amassed all this information, all this knowledge, then your intuition becomes good enough that you can appear for the step 2 exam and score very good despite not knowing what the right answer is. The goal of this course is to help you make that clinical judgment that you can use during your step 2 and during your step 3 examinations. So this is our question. We got two incorrect answers. Let's move on to question 3. Let's see this. Remainder of the examination shows no abnormalities. Now, this line is very important. Do not dismiss these lines. Sometimes the answer to your questions when you are stuck between two options will come from lines like these. These are lines called negative lines. They are not confirming anything, they are just saying that everything else is normal. So, that is also important. For example, if you are suspecting pulmonary embolism and the question says that there is no tachypnea, there is no abnormality in the respiratory system at all, then it is not likely a pulmonary embolism. If there is normal saturation, normal respiratory rate, it is not a pulmonary embolism. They will present it like this, that the remainder of the examination shows no abnormalities. So you also have to keep this in mind, that decipher this according to your options. So, after obtaining early morning ACTH and cortisol levels, both were found to be low, but 1 hour after co-centropin stimulation, cortisol increases. Compared to average individual, this patient prior to presentation had which of the following sets of laboratory values? So this is the question. First, you are supposed to make the diagnosis. Is this primary? Is this secondary? Next, if this is primary, then what kind of laboratory values will you get? If this is secondary, what kind of laboratory values will you get? That is what the question wants you to know. So you have to know the difference between primary and secondary. You have to know what the difference is based on symptoms. You have to make that the distinction right now. Is it primary or is it secondary? Just based on the stem. Then in the options, you have to know the difference between their laboratory values, difference between their pathologies. That is how you will get to the answer of this question. A. So the option A is referring to sodium decreased, potassium increased, bicarbonate decreased, glucose decreased. So this is what you see in primary adrenal insufficiency. This patient does not have primary. This patient has secondary. All right. So let's start with the theory now.